arteries. Subclavian arteries have a wide area of distribution as they supply the upper limbs, part of neck and part of thorax and the abdominal wall, part of brain and the spinal cord. The next one, origin of subclavian artery. The right subclavian artery is a branch of brachiocephalic artery, hence it begins behind the right sternoclavicular joint. The left subclavian artery is the direct branch of arch of aorta, hence it begins in the superior mediastinum. The next one, the course of subclavian artery. In the neck, both the arteries pose a similar course. On each side, the subclavian artery arches laterally across the anterior surface of the cervical pleura onto the first rib posterior to the scalenus anterior muscle. The next one, the termination. Each subclavian artery continues as the axillary artery at the outer border of the first rib. The next one, parts. The parts of subclavian artery. The scalenus anterior muscle divide the subclavian artery into three parts. The first part extending from the origin to the medial margin of the scalenus anterior muscle. The second part lies posterior to the scalenus anterior muscle. The third part extends from the lateral margin of scalenus anterior to the outer margin of the first rib. The third part of subclavian artery is located in the subclavian or supraclavicular triangle in the lower subdivision of the posterior triangle of the neck. The third part of subclavian artery is the most superficial and hence its pulsation can be felt on deep pressure. It can be compressed against the first rib by the pressing downward, backward and medially between the posterior margin of the sternocleidomastoid and the clavicle. The next one, that is the relation. The first part of subclavian artery is related anteriorly is related to the right common carotid artery, terminal part of right internal jugular vein, right vagus nerve, right vertebral vein, ansa subclavia and sternothyroid, sternohyoid and sternocleidomastoid muscle. The two nerve loops round the inferior aspect of the right subclavian artery. Then posteriorly it is related by the apex of the right lung, cervical pleura, suprapleural membrane and ansa subclavius. The second part of subclavian artery that is related anteriorly related by the scalenus anterior muscle, right phrenic nerve, transverse cervical artery, suprascapular artery and subclavian vein. And the posterior relations are the suprapleural membrane, cervical pleura and apex of the lungs. The last one, the relation of the third part of the vertebral artery. Anteriorly it is related by the suprascapular vessels, prevertebral fascia, subclavian vein, external jugular vein, anterior jugular vein, transverse cervical vein, subclavius and the middle one-third of the clavicle. And the posterior relations are the scalenus medius, lower trunk of brachial plexus, suprapleural membrane, cervical pleura and apex of the lungs. These are the relations of the subclavian artery. The next one, branches of the subclavian artery. The right subclavian artery gives of three branches from its first part and one branch from the second part, while the left subclavian artery gives of four branches from its first part. The branches from the first part are the vertebral artery, thyrocervical trunk, and internal thoracic artery. The branches from the second part are the costocervical trunk only arising from the right subclavian artery, but no branches from the left subclavian artery. The branches of costocervical trunk are the superior intercostal artery and deep cervical artery. The branches from the third part are there are no branches from the third part, but in a small percentage of population, the dorsal scapular artery is arising from the third part. The dorsal scapular artery replaces the deep branch of the transverse cervical artery. The next, the description of the branches. First one is the vertebral artery. The vertebral artery is a long branch arising from the upper aspect of the first part of subclavian artery. It runs upward to enter the foramen transversarium of the sixth cervical vertebra. Then from the sixth cervical vertebra it reaches into the first cervical vertebra. Then it enters the arches, that is the main content of the suboccipital triangle, and the right and left vertebral artery join together, and it is form a basilar artery that supply for the brain and the spinal cord. So the vertebral artery mainly that is supply the spinal cord, medulla, cerebellum, meninges, and the muscles of the suboccipital triangle. The next branch of the first part, that is the internal thoracic artery. It is arising from the lower aspect of the first part of subclavian artery. It runs downward in the anterior thoracic wall, and it terminates at say musculophrenic artery and the superior epigastric artery. The next branch arising from the first part of subclavian artery are the thyrocervical trunk. It is a short trunk that arising from the upper aspect of the first part of subclavian artery, lateral to the origin of vertebral artery. It immediately divided into three branches: inferior thyroid artery, suprascapular artery, and transverse cervical artery. Of that, the inferior thyroid artery ascends along the medial margin of scalenus anterior, then turn medially in front of the vertebral artery and posterior to the sympathetic chain, and finally it descends to reach the inferior pole of the thyroid gland. It divided into ascending and descending glandular branches. The ascending glandular branches supply the thyroid gland, parathyroid gland. The other branches of the inferior thyroid artery are the ascending cervical, inferior laryngeal, pharyngeal, tracheal, and the esophageal. At the lower pole of the thyroid gland, the artery is closely related to the recurrent laryngeal nerve, which may be injured during the surgery on the thyroid gland while tying the inferior thyroid artery. The next branch, that is the suprascapular artery. The suprascapular artery turns laterally across the scalenus anterior muscle to reaches the posterior triangle. Here it crosses the anterior to the third part of subclavian artery and the brachial plexus. The suprascapular artery and the nerve leave the posterior triangle along the inferior belly of omohyoid and reaches the superior border of the scapula. It passes above the transverse scapular ligament to enter the supraspinous fossa to take part in the arterial anastomosis around the scapula. The next branch of thyrocervical trunk is the transverse cervical artery. The transverse cervical artery divided into superficial and deep branches in the posterior triangle. Frequently, the deep branch take origin directly from the third part of subclavian artery. In the case, it is called as a dorsal scapular artery, which accompanies the dorsal scapula nerve to the back. In such case, the superficial branch represents the transverse cervical artery and travels along the accessory nerve to the deep surface of the trapezius muscle. Next one, cost of cervical trunk that take origin from the posterior aspect of the second part of the right subclavian artery and from the first part of the left subclavian artery. It divides in the superior or the highest intercostal and the deep cervical branches at the neck of the first rib. The superior intercostal artery descends in front of the neck of the first rib and gives posterior intercostal artery to the first two intercostal spaces, and the deep cervical artery passes to the back of the neck where it is ascends in the deep muscles and anastomoses with the descending branches of the occipital artery. Then last one, that is the dorsal scapular artery. In the percentage of population, the dorsal scapular artery take origin from the third part and take place on the deep branch of the transverse cervical artery. It passes posterolaterally between the trunk of the brachial plexus to reaches the levator scapula, and it descends along the medial border of the scapula along with the dorsal scapular nerve and deep to the rhomboideus major and minor muscle. The dorsal scapular artery end by take part in the arterial anastomosis around the scapula. The applied anatomy. The third part of subclavian artery is most superficial and its pulsation can be felt on deep pressure.